Good morning, folks. Ron Ray here with Turning 65 Solutions. This morning, we're going to talk about some changes that are coming to Medicare in 2026. It is now about the middle of September 2025, which means we're coming up on our annual election period, AEP. That's that time from October 15th through December 7th every year when you can make changes to your Medicare Advantage plan or standalone Medicare prescription drug plan. And then for the most part, you're stuck with it after December 7th. And you've got to make wise decisions now when you have the opportunity, because things are changing and you don't want to be stuck in an old plan that was good this year, but it's not going to be good next year, or that plan may be going away and you may or may not be automatically enrolled in a new plan. If you have a Medicare Advantage plan and that plan is discontinued by the company, that company can automatically enroll you in another one of their plans, or they can just leave you alone and you'll automatically revert back to original Medicare A and B, but you'll have no supplement. And so now you're on the hook for 20% of everything with no limit. So you want to be very careful about what's going on. So, me, if you watch the channel, I always go to a third party to bring you some information. This is an article from Kiplinger online, 7 Medicare changes coming in 2026. This article is a few months old, but it's been recently updated just in August. So it's pretty well up to date. There's one little change that probably needs to be made, but I'll point that out to you in a minute. And so we're just going to cut right to the chase with the changes. You've all heard me talk about the IRA, the Inflation Reduction Act of 2022. That made some changes to Medicare, most notably the Medicare prescription drug plan. And the biggest change went into effect last year, where they put a $2,000 annual maximum out of pocket on all prescription drug plans, both Advantage and standalone. This year, 2026, next year, 2026, that cap is going up just a little bit to $2,100. Also, as we knew happened this year, they're no longer covering GLP-1 drugs for weight loss only. You have to have a FDA-approved condition like diabetes or high blood sugar or heart disease together with that in order for Medicare to pay for those. It says here in this article, it's a tad bit misleading. It says the Trump administration didn't follow all recommendations of the previous administration. For example, it declined to cover GLP-1 receptor antagonist, whatever that word is, failed to cover Ozempic, which previous administration had supported. That's not entirely true. It still does cover those drugs as long as there's an FDA-approved condition such as type 2 diabetes or morbid obesity together with heart disease. It depends on the drug what the approval is. So that's a little bit misleading. Those are covered. They're just not covered for weight loss alone. If you have you're getting them for weight loss alone, you don't have any of those other conditions, then yeah, they're not going to be approved. But if they were paying for it, they probably are going to continue paying for it. They did continue for next year the prescription payment plan. That is the MPPP, the Medicare Prescription Payment Plan program. That's where if you can't afford your copay on your drugs when you get to the pharmacy, you can call your company up and they will break those payments up into 12 equal payments. If you're starting in January, you have to have it paid off by the end of the year, and then they're just automatically renewing it for you for next year if you were already enrolled in it this year. The cap on prescription drug expenses has been extended. We just mentioned that, going from $2,000 to $2,100. So once you hit $2,100 in out-of-pocket expense for prescription drugs next year, you're done paying. You won't pay anything else for your prescription drugs for the rest of the year. The Medicare Part D deductible. Now, this is a significant one. This year, it's $590. Next year, it's going to $615. That is your Part D prescription drug plan deductible. That's the maximum deductible that that prescription drug plans are allowed to include. That doesn't mean that they can't have a lower or no deductible. I wouldn't expect too many plans to have no deductible. If they do, they're going to have a pretty high premium. It doesn't mean they're a bad plan, depending on what your drugs are. It still may be the best for you, even if it has a very high premium, say, $90 or $100 or $120 a month, but it's got zero deductible. We can usually show you how that plan will be better for your current prescription. See, what we do is we put in all your prescriptions into the software, and it takes all of the plans that are available and it sorts them by your total out-of-pocket cost for the whole year. That includes the premiums that you pay for the plan, the deductibles that you may have, which may be zero or up to $615 next year, and your copays when you go to the pharmacy. It adds all of that up and it tells us what's your actual bottom line out-of-pocket for the whole year. And then we just go with the one that's going to cost you the least, even if it may have a higher premium. If it's got a $90 a month premium versus a zero premium, but your drugs cost so much that you're going to get to that $2,100 cap faster by having the more expensive plan, then that more expensive plan makes sense. Now, it's hard to understand that with me yelling at you on a video, but let us put it on paper for you and we'll show you. And we'll show you all of them. We'll show you all the plans that are available, and you just pick the one that makes the most sense to you. Now, they did put a limit on supplemental benefits for chronically ill. So there are certain Medicare Advantage plans called SNP plans, special needs plans, and there's special needs plans for people with chronic illnesses. And those special needs plans tend to have all these extra benefits that aren't medical benefits with them. They have food cards and health club memberships and over-the-counter allowances and transportation benefits and allowances for pet food even. There's all kinds of those. They put a limit on those benefits for next year because they felt that those plans were being sold more for the non-medical benefits than they were being sold for the medical benefits. And a lot of people got kind of tricked into changing plans because, this plan, well, you know what? So you get a call from a telemarketer and say, hey, we got this plan that it pays for your pet food, for your dog food. So you can save that money if you're paying, $40 a month for dog food. Our plan over here, it'll cover that dog food for you. But what they didn't tell you is now you can't go to your cardiologist because he's not in the network. So we always sell plans based on the medical benefits first. And if the non-medical benefits, the extra stuff is good for you, then that's good. But that's not our primary concern. Well, Medicare felt the same way. So they put a limit on the benefits, and it seems like they're not you can't use the food cards to buy alcohol, tobacco, cannabis product, non-healthy foods. They don't really define what that is, but I'm sure you'll find out when you get to the store. They can't offer life insurance, hospital indemnity insurance, funeral planning expenses, procedure, cosmetic surgery, cosmetic procedures, or broad membership programs inclusive of multiple unrelated services and discounts. So all those things I just mentioned, they put a limit on them. They didn't say they couldn't offer them at all, except for a couple of these things, but they did put a limit on it. Now, this is old news. Insulin costs were capped. This was begun by the first Trump administration, put a $35 cap on insulin. It wasn't mandatory. Plans could opt in or out of it. Most opted in. The Inflation Reduction Act put it into law, at least for the time being. Insulin is capped at $35 for a 1-month supply, or the lower of, actually it's the lesser of $35, 25% of the maximum fair market value, or 25% of the negotiated price. So the most you'll be paying for it is $35 a month for a 1-month supply. They added zero cost sharing for vaccines. That actually happened this year for 2025. So CDC recommended adult vaccines, you pay $0. Now, this is one, initially there was some confusion on this under original Medicare, not Medicare Advantage, original Medicare A and B. There's never been any really need for prior authorizations because the insurance companies don't have any say in the matter. Medicare approves everything ahead of time in a book called the Schedule of Medicare Approved Procedures. And if the doctor wanted to know if something was approved, it just goes and looks it up in the book. There was a plan to begin a pilot program in 6 states that had high utilization and high fraud, waste, and abuse numbers to start requiring prior authorizations on certain procedures only, not on everything. And those states were New Jersey, Ohio, Oklahoma, Texas, Arizona, and Washington. Well, that got rescinded just recently. So that's that one part of this article that still needs to be updated. That happened actually probably just about a week ago. They came back and said that, okay, we're going to scrap that pilot program for now. And we think we've got the fraud, waste, and abuse down from a point last year where we think we don't need to do this just yet. So they've canned that program for now. We'll see if it comes back for 2027. That is the biggest changes that you need to know. There's one thing that you won't see in some of these articles, and that is the fact that Medicare Advantage plans, Medicare prescription drug plans, but Advantage plans more notably for you, they're required to file their plans with the government and for the government to approve them so that they can offer them to the public. Some insurance companies file those plans early and get them approved early. Some plans file them late, right? The plans that once they're approved and they're out there, the government starts putting them on the Medicare.gov website and printing them in their books and they're offered to the public. The insurance companies can't really pull them back. And so they get these plans approved before the new rules even come out. And now they go, we're going to have to pay for a bunch of stuff. This plan's not going to be profitable for us in our estimation. But guess what? They can't pull it off the market. They have to leave it there. So they don't want to sell it, but they can't pull it off the market. So what do? They stop incentivizing agents and brokers from selling those plans. And how do they do that? They stop paying commissions on those plans. There's going to be a lot of Medicare Advantage plans, probably mostly PPOs, that are not going to pay agents like me commissions next year. What does that mean to you? You might think that that's a good thing. You might think it's a bad thing. You might think it's a good thing. Well, agents make too much money anyway. But guess what? Agents are in this business to make a living. I'm not ashamed of that, and I don't think any other agent should be either. But because of that, most agents are probably not going to show you plans that they know they're not going to get paid for if you sign up on one of those plans. One thing that we promise to do for you is we'll show you all of the plans available in your area, regardless of whether they pay us or not, whether we're even contracted to offer those plans. We'll show you all of the plans that are available, and then you just pick the one that makes the most sense to you. We make our money by you being with us long term, because maybe next year you'll buy a plan that does pay us a commission. But in the more short term, maybe you'll refer your friends and family to us and they'll buy something that does pay us a commission. So we work for you, not the insurance companies. We do this is how we make our living, and we do want to get paid, but we'll make this promise to you. We're going to show you all the plans, and you pick the one that makes the most sense to you, regardless of whether it pays us or not. And that list is going to be long. It's not going to be 40 or 50 plans anymore like it used to be, but it might be, because a lot of companies are getting out of the business. Some companies are reducing the number of plans that they offer. So it might be, 15 or 20 or 25 plans. Those lists are going to be smaller. So give us a call here, 830-217-6711. or look us up on the web at t65s.com. We've got a great website with tons of information there. If you like this video, give us a thumbs up below. That helps YouTube get this video out to other people who are seeking the same information that you were this morning. And don't forget to hit that little notification bell so that you can be notified when we upload another new video. We hope you enjoyed it, and we hope you have a great day, folks. Until next time.